A sobering fact about the mental health crisis in New York City is that lately it seems you do not have to go far to meet someone who's homeless, in the subway, and admits to receiving psychiatric care.
I've been in Bellevue
Over and over again.
several times.
We met Patricia, whose face we are blurring to protect her privacy, in a Manhattan subway station Friday evening. She was calm and kind.
It's vital to treat mental crisis as a public health issue.
But New York City public advocate Jamani Williams says there are too many people like Patricia who are routinely arrested by police instead of receiving care from trained mental health professionals.
There are fewer mobile crisis teams now than in 2019.
On Friday, Williams released an update to his 2019 analysis and report on what City Hall could do to improve its response to the mental health crisis. He says while the previous de Blasio administration ignored his recommendations, Williams says the Adams administration is making progress, albeit slowly. Among the advocate's latest recommendations, expand the hours of operation for mobile crisis teams, create a non-police and non-law enforcement phone number for those experiencing a mental health crisis, and fund and build more supportive housing with wraparound services.
I would not want police or someone in a uniform to come to me. I would find that extraordinarily triggering.
Patricia tells us she believes the city has recently been doing a better job of sending social workers into the subways to physically find her and then inject her with an antipsychotic medication.
How often are you supposed to get your injections?
Once a month.
But it would appear, at least in Patricia's case, the city's ability to provide her with sound psychiatric care rests on first having enough social workers on duty and then being lucky enough to find her.
It seems to me it could get pretty hard to find you in this big station.
They know where I'm at. But I usually be sitting outside.
So you heard Patricia saying she usually sits outside above ground. We met her down in the subway and we put a shot of her rolling away in her wheelchair. It's just an example of the kind of challenges that mental health professionals have in getting the services to those who need it the most.